here. Welcome everyone to the June. Oh, if we could mute ourselves when we're not talking, that would be great. Testing. Okay, better. Thank you. Welcome everyone to the June 24th, 2020 special meeting of the Law and Justice Committee. My name is Girmay Zahalai, and I'm the chair of this committee. I would like to thank all of you for being here today. Also, thank you to my colleagues, to the sheriff, to the OLEO director, and to all the guests making public comment, including the public health officials on the line today. I would also like to thank the First People of Seattle, the Duwamish people, past and present. We are on their traditional land and are grateful for them and for the land itself. In light of the COVID-19 pandemic, the governor has issued an emergency order suspending the section of the Open Public Meetings Act that requires we have a physical space for the public to watch our meetings. As such, this special meeting of the Law and Justice Committee is being held in a virtual setting. Today, we will hear several briefings on important and relevant topics across the county and in our communities. First, we'll start with a discussion on the Department of Defense program known as 1033 program, which allows this transfer of military-grade equipment to local law enforcement agencies. Next, we will have a briefing from the Office of Law Enforcement Oversight on the recent update to the Sheriff's Office use of force policies. In our last briefing, we will hear from a panel of experts on racism and police violence as a public health crisis. One final housekeeping note before getting started. To help us manage the meeting, I'd like to ask that the public, as well as all staff, please keep your video off until just before you plan to speak. Thank you so much. Clerk, would you please call the roll?
Thank you, Mr. Chair. Councilmember Dembowski? Councilmember Dunn? Councilmember Cole-Wells?
Here.
Councilmember Lambert? Councilmember Updegrove?
Here.
Mr. Chair.
Thank you, Madam Clerk. Do we have Mr. Bowman on?
Yes, sir.
Thank you for being on, Nick. I'll skip over approving the minutes until we have a quorum, and we'll just jump out to you to start our briefing on the 1033 program. Everyone, we have Nick Bowman here to give us a general introduction to the program, what it is, and how it started. Nick will also cover the type of equipment the King County Sheriff's Office has received through this program. Then we will have Chief Troy Olmstead from the King County Sheriff's Office here to answer any questions to the committee regarding KCSO's use of the 1033 program and the equipment it receives. Mr. Bowman, the line is yours.
Thank you, sir. Good morning, council members. For the record, Nick Bowman, Council Central staff. The chair has asked that I give a general overview of the Department of Defense's 1033 program, which, as he stated, allows the transfer of DoD equipment to law enforcement agencies across the country. Then I will go over the equipment which the King County Sheriff's Office has acquired through the program over the past several years. While congressional allowances for the transfer of military equipment to law enforcement agencies has been around since World War II, the modern program we know today began in earnest during the early 1990s. Section 1208 of the National Defense Authorization Act for fiscal years 1990 and 1991 created a pathway for the DoD to directly transfer defense equipment, including small arms and ammunition, from existing defense stocks without cost to the receiving state or local agency. The initial iteration of the program included a sunset clause, which would have ended the program in 1992, but it was extended until 1997. Section 1033 of the National Defense Authorization Act of 1997 made the program permanent and expanded its usage beyond its initial focus of counter-narcotics into other areas, including counterterrorism. The 1033 program, as it is known today, is administered by the Law Enforcement Support Office of the Defense Logistics Agency within the Department of Defense. Though participating agencies initiate requests for the material, the Defense Logistics Agency retains the final authority to determine the type, quantity, and location of excess military property suitable for transfer and use in law enforcement activities. General categories of equipment offered for transfer include office furniture, household goods, which is mostly kitchen equipment, exercise equipment, portable electronic generators, tents, and general law enforcement supplies like handcuffs, riot shields, holsters, binoculars, and digital cameras. Heavy equipment such as cranes and various types of land vehicles are available. Watercraft, aircraft, and weapons are also eligible for transfer. There is also a litany of other miscellaneous property, including toolkits, first aid kits, blankets and bedding, lawn maintenance supplies, combat boots, and office equipment. Equipment offered to law enforcement through the program, which are not substantially equivalent to what could be found in the general commercial market and or are considered to possess significant military capabilities, such as weapons or tactical vehicles, cannot be released to the general public, and ownership is never transferred to law enforcement agencies. Rather, they are considered to be on loan from the Department of Defense. These items must be accounted for by annual inventories in accordance with federal requirements. Now, according to a 2014 analysis by the New York Times, the equipment law enforcement agencies request and receive varies wildly, with over 18,000 different types of items made available through the 1033 program. From this analysis, the most commonly transferred items include ammunition, electronics, rifles, tools, and cold weather clothing and gear. Now, with regards to the King County Sheriff's Office 1033 inventory, the Sheriff's Office provided the Council with an inventory of equipment acquired through the program dating back to 2013. This inventory can be viewed on page 7 of your packet. Analysis by Council staff shows that the vast majority of items in this inventory fall into the clothing, personal equipment, training supplies, tools, and electronics categories, most often associated with the Sheriff's Office search and rescue efforts. In fact, the Vietnam-era Huey helicopter used for search and rescue operations was acquired through the 1033 program. Other large items in KCSO's inventory include another helicopter used for training, vehicles such as ATVs, four-wheelers, and trucks used for search and rescue efforts, as well as a PAC robot, which is a mobile robot used for bomb disposal, hazmat, search, reconnaissance, and other dangerous missions. According to the inventory, the only weapons acquired by KCSO through the 1033 program were 12 M14 rifles, which had been used by the Sheriff's Office TAC 30 or SWAT unit. According to KCSO, however, these weapons are currently in storage and are in the process of being returned. That concludes my remarks. We have with us on the line Chief Troy Olmstead, who is here to answer any questions the committee members may have on KCSO's use of the 1030 program and the equipment acquired through it.
Thank you so much, Mr. Bowman. Mr. Olmstead, do you want to, or Chief Olmstead, do you want to have a moment to any opening remarks before we open the floor for questions to the members?
No, I think I think Nick covered most everything that we have, and the only thing I would say about the rifles is they were partially used by the TAC team and partially used by our honor guard. A number of them were equipped with white straps, but then we ended using them for either, and they're actually ready to get shipped back pretty quickly. So,
thank you. Members, any questions on the 1033 program military equipment? By the way, Madam Clerk, Councilmember Dembowski is on. I wonder if we want to, is there something we should do to acknowledge that he's present? He's been on from the beginning. He was just muted.
I will mark him as present, Mr. Chair.
Thank you, Mr. Chair.
Thank you, Councilmember Dembowski. Thank you for that report, Mr. Bowman. A couple of questions here. When people have seen, if people have seen other equipment that resembles military equipment, is there a way to identify where those are coming from? Are there other contractors or companies that people should know about? You know, if they see pictures of people in armored vehicles and things like that, are those images from the 1033 program? Are those only being used for search and rescue? So I guess those two questions are when people ask about the images they've seen in the past, are those armored vehicles just search and rescue vehicles? Are they used for other purposes? And are there other sources for equipment that people might perceive to be from the 1033 program?
So we don't use any sort of armored vehicles or anything that any vehicles that appear militaristic that I'm aware of in our search and rescue at all. The Sheriff's Office has 2 armored vehicles that we utilize. These are purchased from a maker of vehicles. They're most specifically made for SWAT and tactical operations. They're not, they are painted black, but they're a matte black, and the purpose of that is to limit a sight picture. If we're using these to safely deliver our personnel into a tactical situation and/or rescuing civilians or injured officers from dangerous situations. They're marked vehicles. Yes, they are what we would call armor plated to protect against any firearms, penetration of rounds or anything like that. But the Sheriff's Office doesn't utilize any, other than the small amount of rifles that we'd actually started the process of sending those back earlier in the year when the COVID started, and that delayed our return. But outside of that, we don't take ammo or firearms or I would say uniforms like the camouflage uniforms or anything like that. We do take a number of flight suits and cold weather gear for the search and rescue people and our helicopter pilots, but they're not anything that is in particular, militaristic. They're available commercially as well.
Thank you, Chief. For the M14 rifles, is there a timeline for returning those?
I talked to our program manager yesterday, and they were at the range being certified as being unloaded and ready to ship back. So we're hoping that within, he couldn't give me an affirmative date because they have to get a clearance from the government. They actually have to be shipped back to Alabama, is where all this operates out of. And they have a process. Any tracked item like that has to be offered to other law enforcement agencies around the country as first dibs. Rather than getting sent back, we would send it to another law enforcement agency. Originally, a sheriff's office in Idaho had interest in the rifles, but they've never followed through on anything, so they're going to allow us to return them now.
Thank you, Chief. Members, any other questions on the 1033 program? We will hear about other policies from KCSO later today, as well as other efforts that our council will be working on moving forward. All right, we'll move on to our next briefing. For our next briefing, we have Office of Law Enforcement Director Deborah Jacobs here to discuss the Sheriff Office's recently revised use of force policies. Director Jacobs, the line is yours.
Thank you. Can you hear me?
Yes, we can hear you.
Great. Good morning. Thank you so much for having the Office of Law Enforcement Oversight present today. I appreciate it. This is a presentation that was expected to take place on February 5th, but because of a lot of great discussion and comment from the public in particular, we held it off and then the virus hit. So here we are picking it back up. I'm here to talk today about changes to the sheriff's procedures for administratively investigating and reviewing officer-involved shootings and other critical incidents. These are recommendations that should not have to wait longer for implementation. Olio started its dialogue about these policies with the Sheriff's Office in June of 2018. In December of 2019, the Sheriff's Office updated the relevant policies, but unfortunately didn't adopt most of Olio's most impactful recommendations. Today, I want to highlight some of the key recommendations, and if you want to kind of follow along, you might reference the memo that I provided in the packet. I apologize that some of this may feel like it's in the weeds. I know you all know that the devil's in the detail. I know that from conversations, the community very much comprehends these issues and the involved nuances, and I appreciate everyone's interest in kind of digging in on stuff that's complicated, because it's really important, and we need to bring all of our community members and other stakeholders along. So the first item I'm going to talk about in the policy is the standard for use of force. The policy currently says that when necessary, a member may use deadly force only when the member has probable cause to believe that the suspect, if not apprehended, poses a threat of serious physical harm to the member or others. When they say member, they mean a member of the personnel of KCSO. So improvement to this policy, instead of poses a threat, Olio recommended an imminent or immediate threat of serious physical harm would be our recommendation. And then within the systemic review of the shooting of My Chance Dunlap Gittins, the OIR group recommended a standard of identifiable imminent threat. So Olio wants to recommend that the Sheriff's Office update its policy to be consistent with leading progressive police departments and make it clear that it has to be an imminent threat in order to use deadly force. So that's the first recommendation I want to highlight. Another one is one that was a little bit touched on in the past in Law and Justice Committee, but it's about how they get accounts from officers involved in shootings and other critical incidents. Currently, the policy allows for the involved personnel to provide a written statement within 48 hours after the incident. The practice we would recommend is the same as what Seattle has adopted, which is for an interview to take place within the time before end of shift after an incident. So instead of a written statement after 2 sleep cycles, it would be an interview by end of shift. Although there is some information out there by a group called Force Science that suggests that giving sleep cycles might aid memory. In fact, that's been pretty healthily contradicted. And in fact, Force Science itself just sent out an email in the last couple of weeks questioning its own guidance on that front. So changing that would really provide the Sheriff's Office to get the best, most accurate account of what the officer can recall took place at the time. I just want to note for you that everybody should remember that there's at least two kinds of investigations that take place after an officer-involved shooting or critical incident. One is the criminal investigation, which is under I-940 now, and the administrative investigation is done internally, and that's the investigation that's going to determine whether the shooting was justified, whether there were violations of policy or training as well. So with, at this point, criminal charges being not common, the administrative investigation is really the opportunity to learn from the incident and see how the department can improve its own operations and the safety of its own personnel as well as the public in its operations. Okay, so the next area I want to talk about is about how the Sheriff's Office assesses whether a shooting or incident was justified, a use of force was justified, and whether it was consistent with policy and training. And within the policy, they have a series of questions that a review board asks. The review board consists of people representing different expertise in the Sheriff's Office, as well as a Police Officers Guild representative, and they vote on a series of questions, which you can find in the materials. So one of the problems is that the questions they ask have thus far ensured that all shootings were found to be justified. And one of the problems is the policy really looks at the moment at which the officer feels their life is threatened, and not necessarily at everything leading up in determining whether an incident was justified. So the question is to the fact of, was this, regardless of choices leading up to the shooting, was it justified? And the problem is that, you know, when you talk about de-escalation, there's a lot of opportunity to establish time to slow it down by being far away from a person, by finding cover. You know, distance and cover and time are keys to giving enough space to have an opportunity to de-escalate. And if the sheriff's office isn't thinking about those opportunities to de-escalate up until the moment and only asking, well, once the knife was a foot, you know, close to you, or the gun was pointed at you, were you justified? The answer is always going to be yes, because you're justified based on the language I just shared. Once it's reasonable, what was the language? Poses a threat of physical harm to the member or others. So we would really like to see those questions fleshed out. We would like to ask that the department follow the lead of other practices, such as asking whether the force was reasonable, necessary, and proportional. There's a number of ways the questions are worded that don't get the department to the information it needs to assess whether there are changes to operations that could be helpful or to guide the next steps. And I observe these critical incident review board meetings and have the opportunity to participate. And I see the board members struggle with the questions and acknowledge that the questions don't quite get where they want to go. And they certainly don't get where the public wants to go, which is like a broader scope look at what contributed to this incident taking place. So there are a lot of issues around there, including on de-escalation. I think, you know, over time, it would be really helpful if this committee, the public, and other stakeholders could have more of a conversation about what de-escalation actually looks like, because we're feeling like there's and observing that there's a disconnect between the public's view of de-escalation and law enforcement view of de-escalation, and it would be helpful to have a conversation to learn more about that from each other. Another area that we would like to see revised is related to the obligation to give aid after a critical incident. And the policy previously said that a person had to be medically evaluated by aid, which means someone with professional medical credentials. But that by aid was taken out in the new policy revision, and we would not want to have untrained sheriff's office personnel evaluating people's medical condition instead of professionals who are trained for that. So the removal of that word by aid is really essential to get back in the policy. The next area I want to highlight relates to the thoroughness of review and follow through to ensure that identified issues are addressed through policy training and supervision. This really connects to the My Chance Dunlap Gittins review, because as you recall, there were many recommendations in Olio's report that was produced by the OIR group that were consistent with recommendations that the Sheriff's Office own personnel had suggested after the incident, but had for the most part not been followed through with. So getting into the policy these follow through practices would be very important. So on the thoroughness front, there's something called an administrative review team, or ART, and they do that administrative review of the sheriff's office for the incident for the internal purposes. And for example, in the description, it leaves out that they are supposed to also consider investigatory and supervisory issues, as well as other aspects of the incident. So I think that's really important to get in there. It also really lacks language to ensure that the department will follow through on its finding. Consistent with the OIR group's report, the Critical Incident Review Board and the Sheriff's Office should consider and approve any ART recommendations or disapprove them and provide analysis or rationale for why they're disapproved. And this applies to at least 3 sections of that policy. And there are also several places in the policy in which there's a lack of process for following through with lessons learned. We would especially like the Sheriff's Office to establish processes for debriefing the involved personnel, not just notifying them of a finding. The involved deputies should receive a complete debriefing of any issues identified through the review process and provide opportunity to provide their insights. In addition, the policy says how personnel should be notified if the incident is determined that it to be not justified. But the policy does not contemplate, they have it to notify if the incident is determined to be justified, but not to be if it's not justified. And so, you know, it should contemplate the idea that sometimes the shootings won't be. It should contemplate the idea that a shooting might not be found justified and figure out how to interact with personnel on that. And of course, the Police Officers Guild should have viewpoints on that as well. Finally, on that section, it provides no mechanism to advance the findings and recommendations relating to equipment supervision, investigation, et cetera. And this, you know, gets into the struggle that the Sheriff's Office has in general with being a very lean department and not having adequate personnel. So it's really important that it be in writing so that it be assigned to someone to follow through. The last group of policy issues that I'm going to talk about relate to ensuring that the policy is consistent with OLEO's authorities. For example, after an officer-involved shooting, there's something called a 72-hour briefing. It's the sheriff's 72-hour briefing. And even though the administrative review team is allowed to be in part of that meeting, they would not be in the part where the criminal investigators are because those two things are separated. But even though the ART team is allowed to be in, OLEO, which kind of monitors the work of the ART team, is not allowed to be in. The Sheriff's Office said that the rationale for our exclusion from that important meeting is that the Police Officers Guild is also excluded from the meeting. But to me, the role of OLEO in serving the interests of the public should not directly relate to the OLA, the Police Officers Guild, in its work to promote workplace rights for its members. And the sheriff, as an independent elected, certainly has a prerogative to determine whether to include OLEO as a representative in the meeting so that we can essentially follow the work of the ART team and be fully informed as we monitor that investigation. The GOM also says that the ART team will, when possible, notify OLEO in advance of interviews of involved officers or witnesses. And based on OLEO's authorities, we should always receive notification to attend these critically important interviews, and the when possible should be removed. And especially with something as important as a shooting review, it's really essential that oversight be allowed its authority to sit in on those interviews. I might also add that I think OLEO's presence often improves the quality of those interviews. That's feedback I've received from KCSO personnel as well. Finally, the GOM contradicts both OLEO's ordinance as well as the collective bargaining agreement because it delays OLEO's access to the ART investigatory files uploaded to IA Pro. OLEO should be entitled to this access in real time. That's what all our supporting documents say, and it's something that needs to be altered in the policy. So these are the highlights. It's a lot, but there's also a lot more. And for A+ extra credit students, you can read through our couple years worth of memos back and forth on it, which are in the packet. In closing, I want to note that a few days ago, the Sheriff's Office announced it was working to comply with the 8 that can't wait policy recommendations. Their news release noted that the Sheriff's Office had accomplished related policy changes in just a few days, which is amazing. The 8 that can't wait policy changes are part of the same section of the GOM as the recommendations OLEO has just reviewed, and they've been in discussion for a couple of years now. Olio believes that the recommendations we're presenting also can't wait, and we ask that they be given similar priority and similar expediency. Thank you.
Thank you so much for that, Director Jacobs. We appreciate the work that you're doing, and we look forward to working with you to make these critical changes happen. Members, any questions for Director Jacobs?
I had a couple.
Councilmember Domowski.
Thank you very much, Mr. Chair. Thanks for having this important hearing and continuing the work. And Director Jacobs, thank you for your presentation. I had a question just to help me understand the process a little bit better with respect to use of deadly force or, and that is the fear of imminent, I forget the standard you articulated, the fear of imminent threat to the officer's life or others. And the review of that, is the review of that done on a subjective basis or an objective basis? In other words, is it what the officer believed no matter what, or is it what the officer was reasonably entitled to believe based on the facts and circumstances and an objective person or reasonable person standard as we would use in the law?
So even though I think of myself as a good pretend lawyer, I don't actually feel like I can answer this one for you. I believe for the most part, it's from the officer's view. Like if they felt that their life was under threat, then they are justified. And that is one of the reasons that we would like to tighten that language a little bit. But perhaps while we're in conversation, someone else can chime in, or perhaps the KCSO representative on the phone can chime in to confirm that what I've said is accurate.
I defer if anybody else wants to. And pending that, a follow-up question on the critical review board. You indicated a little bit of how that's who's on that, but I wonder if you could spell that out a little bit more. How many folks sit on a critical review board at the sheriff's office? Who convenes the board? Who decides who sits on the board? Are those reviews public meetings or otherwise available for public review? I just have an interest in independent assessments of these kind of things, because I think nearly every other profession, when things go wrong, whether it's in aviation or lawyering or politicking or teaching or doctoring or nursing, there are independent reviews. And that just builds a little more confidence and trust in the system, and I think leads to better assessments, not biased assessments, but better assessments that can help an individual and an organization. That's kind of a general theme of mine, which is, as you know, with your office, I think very important. So I wonder on the structure we have today, going back to the original question here, who assembles the review board? Who's on it? How does it work?
Yeah, so I will answer part of that, and I see Patty's video popped up, and I'll let her chime in as well on perhaps both of your questions. So it's, I believe, has 6 members, 5 of whom are KCSO personnel representing like training or patrol or different divisions, and then also a representative of the Police Officers Guild. Those are the voting members. Olio is considered a member, but we are a non-voting member. We are allowed to bring 1 representative and have recently had good conversation with the Police Officers Guild, who did not object to us bringing a second person to observe as well, because it's really hard to kind of follow everything and hear everything and read the room and everything when you're one person alone in there. In addition to the review board members, there are other KCSO personnel present. I think it would be great. It's not open to the public. I think it should be. It's something I remember Sheriff Urquhart telling me he thought they should be open to the public, and I was really surprised at the time. But the more I thought about it, the more I realized he was right. I think there are things that could be done possibly to protect workplace rights for those involved in the incident if it were open to the public. And then the other thing is I think it'd be really important and really valuable if a representative from King County Risk Management was also allowed to be present or observe or even be a part of the review board. But that perspective is very helpful in other review boards to have risk management there. So that would also be a big benefit. Patty, did I get all that right?
Good morning. You got some of it. So the person who convened the critical incident review board is the undersheriff. And we have a number of participants depending on which division the deputy who used force is part of. It is that division chief that attends, that sits on the panel. We also have our senior legal advisor who sits on the panel, as Deborah indicated, also our training sergeant, a representative from there. We have a guild representative, and I think maybe one other person. We have a number of people are there to observe that our agency personnel. Olio is a non-voting member that is there for the whole process and can ask questions and bring up points of clarification. And in fact, Deborah has done that in our last few. We've had 3 recent critical incident review boards, and Deborah's been at those, and we have, I believe, 4 more we need to schedule. So that's that question. The other question that Councilmember Dembowski had about the standard. So I want to read this from our general orders manual. So we have in our policy, the objective standard is any use of force that must be objectively reasonable. The reasonableness of a particular use of force is based on the totality of circumstances known by the officer at the time of the use of force and weighs the actions of the officer against the rights of the subject. So that is actually in our policy.
Very clear. Patty, thank you.
You're welcome. You're welcome. So just to go back to the critical incident review board, I want to make sure I have this correct. We have to have so many members to have a quorum. The undersheriff, like I said, is the chair. Chief of patrol or whatever appropriate division chief. We have a patrol operations captain who's chosen by the chair to sit on the panel. The sergeant from our training unit, as I talked about, the union rep, and we have a legal advisor. Olio is non-voting. And then if there's anybody else who we would have there, they would be non-voting. It is not open to the public. This is an internal meeting. So that hopefully that answers your question.
Patty, it really goes a long way to helping me understand it better.
I can't hear you.
Good, Mr. Chair, one final kind of follow-up.
I'm sorry, I can't hear you.
Oh, is that better?
Yes.
Yep.
Thank you. It goes a long way, Patty, toward helping me understand the process a little better. And Mr. Chair, if I might add just one more question, and that is, if you would, Under Sheriff Cole Tindall, tell us just what the end product is of those critical review boards. Is it a written report?
Yes. It is. Absolutely. It is a written report. And as Director Jacobs talked about, there's a number of questions that the board answers. And we have a scribe, somebody who's responsible for documenting what happens in that meeting, in addition to lessons learned from the incident. So, and that is something that we do look at. This memo that goes, it's documented, goes to the sheriff. Obviously, those are public documents. So those are things we can share, but attendance at the hearing or the board, we do not have public.
Thank you for the information. It's helpful. Thank you, Mr. Chair.
Thank you so much, Councilmember Dembowski. Any other members have questions?
Mr. Chair, Councilmember Dunn, just want to let you know I'm on the line.
Okay, thank you, Councilmember Dunn.
Lambert.
Councilmember Lambert.
Thank you, Mr. Chair. I have 3 questions. First of all, there seems to be a dichotomy in what is the fact. And I always figure if you don't agree on what the facts are, it doesn't help. So on one hand, we have the Journal of Applied Research in Memory and Cognition article saying one thing. And then in a report that I read yesterday, it's the international something or other that is the research on cognition needs 2 sleep cycles. So how do we get to the place of what is the correct fact? There is either a fact or it's not a fact. So you need to figure out which is correct. So Patty's nodding her head. So I think Patty knows what I'm talking about. So Patty, would you like to answer that question?
Yes, I think there are differences of opinion, right? So Director Jacobs spoke about information that was supplied just recently by the Force Science Organization, and they actually asked, what's correct? Is a 48 hours still correct? And their article says, you know what, they still believe that's correct. I just think like in many things, there's a difference of opinion. I think the way we get to what the right answer is we talk, right? We communicate, we figure out what is best for us here at King County and for our agency. So I think dialoguing with the council, the community, with Director Jacobs, we're going to be able to come up with something. Now, we used to have a 72 hours. So we've already made improvements to move from 72 to 48 hours. But from our information and the IACP, which is the International Association of Chiefs of Police, their recommendation is 48 hours, which is a standard. So again, I think us talking, dialoguing, figuring out, is 48 hours not right? I know I've heard mentioned previously that people who are involved in an incident with the police, we get their statement immediately. They don't have the luxury or benefit of waiting 48 hours to give their statement. But when we're talking about a use of force and potentially an officer-involved shooting, we are adhering to and honoring what the guidance is for police agencies, which is after 48 hours, or it's going to be much clearer to the officer and they will be more coherent. I'm told, and I haven't seen this actually, that when you get a statement from somebody right after the fact, there's a lot of emotion you can imagine, right? After having to use your firearm to potentially take somebody's life, there's a lot going on. And so having those sleep cycles helps to get a better statement. And the mind does interesting things, with shock or when you're in some issue, some situation where could it be a car accident or whatever, So having that time, we believe is appropriate. But we are open to improvement. We are open to talking about this and seeing, where we can go if it is something that is not right. But for right now, we moved from 72 hours to 48. So used to be 3 sleep cycles. So we're not sure is, immediate. It's not been debunked, basically, the 48 hours. So that's where we're at right now.
If I may also weigh in on that. So the two groups that are suggesting the 48 hours are both law enforcement organizations. The science end of it, the university end of it, Elizabeth Flotis, et cetera, they, I think, are pretty much in agreement. And, one of the things is the public's view is that when there is an officer-involved shooting, the public would like to have that shooting approached as a homicide investigation. So the practices that you would have for a homicide investigation should be the same as the practices for an officer-involved shooting in terms of those types of practices. So that's, I think, a little bit of a gear shift. Also, while people may be fuzzy and confused and obviously traumatized after being involved in an incident, it doesn't mean it's the only time you talk to them. You can follow up with other questions. You can also get a written or verbal statement from them in a couple days, but it would be a shame to miss the opportunity to gain information that might not be available if you wait a couple days.
Can I just add to Director Jacobs' point? If it is a homicide investigation, they don't have to make a statement at all. So if they're, so at that time, I mean, they can say, we're not going to make a statement. This criminal investigation, we cannot compel an employee to give a statement.
Yes, the way it works for the public's benefit is that there are concurrent criminal and administrative investigations. The statement is compelled by the sheriff's office for the purpose of the administrative investigation and is walled off from the criminal. That information is bright line separated from the criminal investigation. So when it is an officer involved shooting, there is a criminal investigation. It's the I-940 investigation, and there is an administrative. The statement will be compelled for the administrative, and that is the opportunity that we're looking at right here.
Well, I think we're saying the same thing. We're saying there's the administrative investigation, which we can compel an employee, you must give a statement. The criminal investigation, they don't have to give a statement. And that statement that was given over here doesn't get shared over here. So I don't think we're saying anything different.
So it's clear that that's something we need to get to the bottom of to make that decision. Because it sounds like we're further apart than maybe Patty's saying that we are. I do know that.
Oh, I'm in on the statement. I'm sorry.
Yeah. When I was robbed at gunpoint, the training I had was that you don't talk to anybody until you need more time. And I will tell you that it did play in my head because when you look at the barrel of a gun, it does make you a little disconcerted. And it does come back with more things that you didn't see in the beginning. My second question is that the Critical Review Board, and we did talk about a minute ago about who are on those boards. But one of the things that I have some concerns about, whether it's the Critical Review Board or whether it's the advisory board, that there are people on that board who do not live in the area that is being patrolled. And I think it's very important that the people who are giving advice on how the department should work should be people who live under that, so that they have direct response and that they don't bring in other biases. So that is a concern as I hear some things being said. And because the unincorporated area, I have at least a third, if not half of the area, I have at least a third of the opinion, if maybe not half of the opinion. And for my part, I do not get complaints that some of the calibers of things that I'm hearing. Instead, I hear we love our officers and we couldn't have done such and such without them or whatever. So I think we need to be very careful about who's bringing in what biases, and the people who are directly receiving the services should be the one that is rating what's going on. So I just wanted to bring that out. And I think as we look at who's on the Critical Review Board, and actually I did like the idea of risk management being on there, just because of what risk management is, but also because we have one of the best risk managers in the country. And she did not pay me to say that, but she is. And so she is able to come up with ideas that maybe none of the rest of us would see because she's an expert in that. So anyway, and I want to applaud the comment that Deborah made earlier about what a great job the Sheriff's Office did in getting those negotiations done so quickly and so well within a 2-week time period. And so I thank them for that dedication also. Thank you, Mr. Chair.
Thank you, Councilmember Lambert. Couple comments on my end as well. Oh, is somebody
Colwell.
talking? Okay, thank you, Councilmember Colwell. I'll call on you in 1 second. I just wanted talk about a couple of the things that I heard. So again, for the public, when we were talking about the 48-hour rule, what we're talking about is after an officer shoots someone, how long before they have to give a testimony of their recounting of events. And currently the standard is 48 hours. And the concern that I have and that many people have is that 48 hours, what happens in that window? Is in that amount of time, can there be conspiring? Can there be colluding to talk through what actually happened? Giving people that long of a window sounds to me like a safety. And, you know, we've talked a little bit about the brain science, and that Director Jacobs mentioned how the organizations that do say 48 hours is standard for brain science maybe have a conflict of interest for saying that. One of the bigger concerns also that I have is that, do we extend that same kind of rule for the public if they're involved in a shooting? Do we say, you know, if you wait 48 hours, your version of events will be better? Yes, people have their Fifth Amendment constitutional rights against self-incrimination, but assuming, you know, they were told their Miranda rights, assuming that they understood their Miranda rights, assuming that they waived their Miranda rights, are we still saying that if they waited 48 hours, their testimony would be better? I don't think we do allow people that. So that's a clear double standard in my opinion. And, you know, we can spend a lot of time talking about this specific nitpicky issue, which I do believe is a huge conflict of interest and allows for collusion and other bad things. But the bigger issue is one that Councilmember Updegrove noted last week, which is that the only forms of oversight and change that we can implement in the King County Sheriff's Office are ones that the Sheriff's Office agrees to itself through the bargaining process. Oversight should not be subject to bargaining. That should be an independent function that we have a community board do investigations. Otherwise, again, we're only allowed to investigate through the ways that the Sheriff's Office allows us to do through the bargaining process. And we are working on a few different things to the charter to make sure that we are allowed true independent oversight. So that's just one thing that I wanted to note. Councilmember Colwells.
Thank you, Mr. Chair. Actually, very well said. That's what I was going to ask about. In terms of providing the opportunity for an officer involved in an officer-involved shooting to have 48 hours to go by, maybe 36 hours, 24 hours, I do think there's that opportunity for getting the story together if another officer is also involved. And as far as I understand, when we have somebody arrested, brought in for questioning, whatever, we separate, that they are separated out from others involved too, so they do not, so to speak, get their stories straight, get them together, so they will have the same recollections of what happened. So I think there is a real difference in treatment that's pretty obvious between officers and those charged or brought in for questioning. Thank you, Mr. Chair.
Thank you, Councilmember Colwells. Any other questions from the members before we move on?
Can I?
Chief Cole Tindall, please.
I just would like to respond if that's okay, or just
Absolutely.
Okay. So I want to thank you for inviting us and allowing us to speak today. So improving our use of force policies is an ongoing process for us. It is important to us, and we reassess our policies and our training to ensure that we are doing our work in the safest way possible, not only for our officers, but for the community. So this review that we're talking about today overlaps with another project that we're working on that you're aware of, and that's the response to the Dunlap-Gittins report. We have agreed to meet with the family to go over our answers, and that is scheduled for mid-July. We felt that meeting with the family to discuss our responses to the recommendations was respectful prior to us responding back. And we're not going to make any final decisions until that meeting has happened. We also are very interested in getting feedback from the council on our use of force policies. We, of course, have had feedback and interaction with Director Jacobs and Olio on that, but we'd be interested in hearing what the council has to say about our policies. I want to add that just a couple weeks ago, I think you're all aware, we added our use of force dashboards in an effort to be transparent to the community about our uses of force. And that data goes back 6 years, 2014 to 19. Anybody can go onto the website and look at the data, slice it, dice it, however they'd like to. We also are available for questions if people want certain queries. So that effort was important because we felt that being transparent is important. And so far we have had over 3,000 hits in the 2 weeks that we've had that up. 8 Can't Wait, Director Jacobs talked to that about that for a few minutes. Most of you are familiar with the 8 Can't Wait. If you aren't, it's 8 progressive policies that the organization is encouraging all law enforcement agencies to adopt. We believe Woodinville, one of our contract cities, sent our policies to the organization. 6 of the 8 immediately were accepted. 2 policies needed some tweaking, and that's what we worked with labor to get the tweaking on that. And one was the duty to intervene, and the other was a verbal warning before shooting. We believe we were already doing this in practice, but our policy didn't quite reflect that. So those have been updated. In 2019, we did an update to our use of force policies. It was a lengthy review, and again, this is another example where we want to continue to review and improve our policies. So we have an enhanced description in there in terms of de-escalation, clarifying that disengagement is an option. We have reporting obligations. Used to be if an officer or deputy drew their weapon and pointed at somebody, they did not have to report that. It has now changed. 2019, we said anytime you pull your weapon out, it needs to be reported. So there's a requirement to the deputy to report that as a use of force, even though they didn't discharge their weapon or taser. It's the same. So even if they're just showing the weapon, that we want that documented. We modified the review board procedures. Deborah talked about that a little bit. I also want to say that we do have a lessons learned component in that critical incident review board. So that document that I described for Councilmember Dembowski that goes to the sheriff outlining what happened also has lessons learned. We, in those 2019 improvement to our use of force, we have a supervisor's checklist, improved handling of the way we deal with firearms after an officer involves shooting, improved language on an obligation to provide timely medical care. Also, I-940, if you're all aware of that, that's the state law that has certain requirements, and we have updated our policy to reflect the requirements to the state law. We have banned neck restraints. The vascular and airway neck restraint is considered deadly force and is prohibited unless it is the last resort. So 2015, that is the year that the 72 hours down to 48 for the statement from the officers took effect. There were a number of other changes at that time. So I do want to also speak just for a minute about, there were some recommendations that Councilmember Jacobs mentioned in her presentation today that we do not feel are appropriate to adopt. We just, we're interested in having conversations, more conversations with her. We want a better product, right? And so that's why we are constantly reviewing these use of force policies, all of our policies. But we're interested in having more conversation, but one is in the interviews. We already talked about that, so I won't go into that. The question that Director Jacobs talked about in the Critical Incident Review Board about the tactics that were used and was the force justified. She has suggested that those be one question, a compound question. And we really feel it's important to keep those as two separate questions. Were the tactics appropriate leading up to the event? And then was the use of force justified? Two separate questions, not one compound question. So again, that's just how we see it. And her recommendation is different. We believe that her recommendation is inconsistent with the state standard and the issue of creating the compound question. And the last thing I'll say is the piece about including imminent or immediate threat of serious physical harm that we have in the policy, and the element of, is it proportional? We do believe our current policies are consistent with the current law and includes totality of the circumstances, subjective and objective standard, and incorporates all the concepts. But we are willing to consider changes to the language if it makes sense or if it's warranted. So if there's nothing else that you walk away with today, I want people to understand we are very interested in collaborating, talking about, changes that could be made, and then actually making some changes. Thank you.
Thank you,
May
Chief
I-
Cole Tindall.
Lambert.
Sorry. May I respond quickly?
Let's make it very brief, though. We want to make sure that we are able to get to the public as well as the public health officials. Thank you.
Promise, I'll be quick. Relating to the Critical Incident Review Board and who it includes, I do want to note that it's great that Chief Cole Tindall is a voting member as undersheriff. And what is great about that is that Chief Cole Tindall is a civilian who has not worked as a police officer. And to me, that shows a vote of confidence for the understanding and knowledge of civilians on assessing use of force. So I want to note that. Also on the 8 that can't wait, one thing I'm confused about with the sheriff's policies qualifying is that on the 8 that can't wait website, they specifically say no exceptions, or they say in all cases. That applies to the shooting at moving vehicles, the choke holds, and the giving warnings before shooting. And in all cases, the sheriff's office does have exceptions for that. I'm not passing judgment on whether those exceptions should be there or not, but what I'm confused about is how they would comply with 8 that can't wait when they say in all cases. And last thing I'd say is I'm hoping at some point this body will have a conversation about the status of I-940 implementation in King County. But one piece that I believe is missing with the sheriff's office is if the sheriff's office is involved in conducting I-940 investigations really on either side, there's a requirement of having 2 community observers involved with the investigation. Many cities and counties have put out notices seeking community participation and interest in that role. And I have not seen, maybe it went out and I missed it, but I have not seen any such thing. I'm not aware of community engagement in those I-940 investigations. And similarly, there's a requirement to give weekly updates, even if the update is there is no update. And I don't believe that's also taking place yet. So I look forward to talking more about those, and I'll stop there. Thank you.
Thank you so much. Next up, we will go to Councilmember Lambert.
Thank
Please
you.
go ahead. Yep.
2 quick clarifications. Patty, you said there were 2 things in the 8 can't wait. One was a verbal warning. What was the other one?
The other one was duty to intervene.
Duty to intervene. Okay. And then the other question I wanted to clarify. So now I'm confused. It was said that officers have more rights than the criminals, but if the criminals are under a criminal investigation and the administrative review is only to look at policy violations, I don't understand how that has anything to do with criminal, because you're looking at the policy in the administrative review. So I think that they're being meshed together when they're 2 separate things, or are they not 2 separate things?
So I think the concept is really what is the best practice when an incident has taken place for interviewing or getting a statement from the person. I would expect that the best practice is the best practice, whether it is a criminal investigation or whether it is an administrative investigation in terms of asking people questions and getting information. I noted that the public has a desire to see these incidents investigated as homicides, which is what I-940 is all about. But that part of the investigation obviously does not involve the compelled statement. The underlying issue is what is the best way to get information from people after a shooting, regardless of whether it's being administrative or criminally investigated.
So I think it's important for us to realize that they're very, very separate, and we're making them kind of like one, and they have different purposes. So I think that's something we also need to continue to clarify as we go forward. Thank you, Mr. Chair.
Thank you, Councilmember Lambert. Just for the public's knowledge, we will go to our last briefing, which is a panel discussion on racism and police violence as a public health crisis. And then we will go to public comment as well. So for the members of the public who've been raising their hands and wanting to make comment, your time will come right after this last panel. So with us today are Edwin Lindo, Dr. Estelle Williams, Dr. Benjamin Danielson, Dr. Aneesa Ibrahim, and Dr. Pamela Collins. Whoever would like to go first, you may please proceed. Thank you so much to all of you for being with us.
Wonderful. Thank you so much. I appreciate you and the entire council for letting us present today. Again, my name is Dr. Estelle Williams. I'm a general surgeon at the University of Washington, assistant professor of surgery. And I will just open this up, and then we will go on to some of my colleagues who will be presenting some more of the specifics. But just to set the tone, I penned a letter that was distributed through the University of Washington and the health system. And we are, as physicians, wanting to include our voice and our message from a public health standpoint. This, again, are reflections of our own opinions as public health experts, but want to, as a collective voice, highlight the health implications of police violence and its impact on communities. And I would like to just open by saying that the way in which we view this is the public health crisis at hand is the police violence in and of itself. And until we address the racism and police violence as a public health crisis, we will continue to have marginalized communities and communities of color that are being disproportionately impacted. And so I have included a couple of my colleagues in this conversation, and we'll begin with hearing from Dr. Pamela Collins, who is a professor in the University of Washington in the Department of Psychiatry, followed by Dr. Ben Danielson, medical director at Odessa Brown. This will be followed by Dr. Aneesa Ibrahim, who is medical director at Harborview Pediatrics Clinic, followed by Edwin Lindo, who is a lecturer within the Department of Family Medicine. So Dr. Collins.
Thank you. Thank you very much. And it's a pleasure to be here. And thank you for the opportunity to speak. So I think all of us realize that the social environment in which we live influences our mental health. The effects of our social experiences will, of course, differ according to our personal histories and the context in which we live. And this is important because mental and substance use disorders as a group are the leading causes of disability in our state as well as globally. In Washington state, about 18% of people live with a mental or substance use disorder, and that's nearly 1 in 5 people. And pretty much when you ask a group of people on this call, sitting in a room, everyone knows someone who is affected by a mental or substance use disorder. And these conditions cause suffering and distress for individuals who experience them, and often the people close to them. And I want to set the stage for this because I want to make clear that having a mental health condition like major depression, as well as more severe conditions, is also associated with excess mortality. So when I talk about these conditions, I'm talking about not just disability, but also excess mortality. We usually associate them with deaths by suicide, but about 8 million excess deaths due to cardiovascular disease, due to pulmonary disease, due to other non-communicable diseases, as well as infectious diseases occur among people with a diagnosed mental disorder. So that is the context. So when we talk about the social environment increasing risk, Black Americans, for example, are nearly 3 times more likely than white Americans to be killed by police and 5 times more likely than white Americans to be killed unarmed. And these disparities are rooted in cultural and structural racism. And we know that racism has consequences for mental health outcomes. Racial discrimination is a driver of poor health outcomes, including mental health. A recent review has shown that discrimination is linked to negative emotions, declines in trust, increases in mood and anxiety disorders over a lifetime. And a greater number of these experiences of discrimination is cumulative. The effects are cumulative and is linked to higher levels of depressive symptoms. Ethnic discrimination is associated with emotional distress, decreased well-being, self-esteem, self-efficacy, and experiences of discrimination decrease our psychological well-being and lead to the increased risk of psychiatric disorders. So it turns out that this discrimination that people experience directly is important in health and mental health outcomes, but it also turns out that racism can be experienced vicariously as well. And a recent study in the Lancet Medical Journal found that police killings of unarmed Black Americans also affects the mental health of Black American adults in the general population. So in other words, there's a spillover effect for other Black American adults, usually living in the same state. This means that such killings lead to a greater number of poor mental health days for Black Americans. And at a population level, police killings of unarmed Black Americans could cause up to 55 million excess poor mental health days per year among Black American adults in the United States. So what do we do about this? We first need to ensure that these killings stop. That's the first thing. The second is that we need to increase access to a range of community-based, culturally and structurally competent mental health resources for Black Americans. And I want to make one more comment, and that's about people who are living in communities anywhere who have an identified mental disorder, who have a mental health condition. I think the second action that we need to take is to ensure that when there is a moment of crisis, when people are in crisis, when they need to call, when family members need to call for help because someone is having an emotional crisis of some sort, we need to find alternatives to the penal system for coming to meet their needs. So I'm going to wrap up. My messages are that the violence that Black Americans specifically experience at the hands of police, even observing other unarmed Black Americans experiences violence, is a threat to mental health. And threats to mental health are serious because they have long-term health consequences. And secondly, we need to take care of the mental health of people who are already living with these conditions, ensuring that they don't unnecessarily get involved with police violence, and ensuring that there are humane ways of meeting the needs of individuals in the community who are living with mental health conditions. Thank you.
Dr. Danielson.
Thank you, and thank you to everyone for allowing me to speak for a few moments and continue on this discussion point. I wanted to also say it's nice to see some of my old colleagues on the Board of Health. I miss you all, and it's very nice to be part of this group of people that are here. I respect everybody on this call today. I'm a pediatrician who works in one of the greatest clinics in the world, the Odessa Brown Children's Clinic. We serve mostly Black and brown kids and families, and we provide care across the spectrum, from primary care for mental health, dental, and medical care. I love my job, and I also realize that I am reminded every day that I'm a rarity because I know that the chance of being kicked out of school for someone like me is 1 in 5 in this country. I know that the chance of a Black man being imprisoned is 1 in 3 in this country. I know that the opportunities for people based on the color of their skin make getting to a position like mine one of great privilege and also I feel important responsibility. We have to talk about this issue from a perspective of a broader community and generational views, because the impacts that we're talking about today are the end result of many, many different layers of racism throughout our society. It is a process. As a pediatrician, I see this as a process of criminalizing children based on the color of their skin. It's a process of criminalization that goes all the way back to data that I just should not need to know or have to talk about, all the way back to preschools where teachers rate some incidents as more troubling and warranting discipline if a child's skin is brown or Black. A process that says that in addition to being 1 chance in 3 likely of being imprisoned in the course of the life of someone like me, that if you're a Black girl, you're almost 4 times more likely to be arrested in school than if you're a white girl. If you're a Latina student, you're 2.7 times more likely to be arrested in elementary school than a white girl. You have to notice that those are statistics that should not even occur. The idea of being arrested in school, let alone the disparity in that number. What I know is that when I see kids in our clinic, 1 in 3 to 1 in 4 of them have a parent who has spent time in prison. There's this process of criminalization that turns our society's eyes, unfortunately, from seeing beautiful, cute, and lovable children to seeing threats as they go through their lives. And I know every mother and grandmother has to talk to their children about this transition that will occur in their life. Every mother, grandparent, and father has to have the talk with their child about how the world will begin to see them as they grow older. I know that this starts to culminate in the kinds of things that have already been talked about like what I consider sort of this earthquake effect, that when incidents are happening around children, it has a direct effect on children. What we heard about in terms of the mental health effects across the state for Black adults, when a shooting of an unarmed Black person happens is known. And what is also known are the effects on school performance and behavior for Black and brown children in neighborhoods where these shootings occur as well. It's an earthquake effect that emanates throughout societies and across communities. I know that someone like me has a 1 in 1,000 chance of dying by a police gunfire in this country. These are the things that are creating the opportunities for this end effect of criminalization and therefore shootings to occur. And we have to understand this across communities and across generations. Anyone who spent any time listening on Juneteenth on Friday to the anguish and the grief and the ongoing pain that families feel when a loved one in their family has been shot by police knows that this is generational. It goes on and on. It affects peripheral parts of families and communities for generations to come. And we also know that there are solutions that work to reduce officer shooting of Black and brown people. They know that there are systematic solutions that have significant effects on the performance. Things like requiring officers to use all other means before shooting, requiring all use of force to be reported, banning chokeholds and strangleholds, having a use of force continuum that is strictly enforced, and using very good de-escalation techniques. Those are all important measures. We have to look at this as a systemic and systematic problem that criminalizes, from society's view, young Black and brown people, and then places them in harm's way at the end of a barrel of a gun in the early parts of their young and promising lives. These are such horrific situations that we live in. We can't wait. We can't wait for longer and longer drawn out conversations. We can't wait for debates about whether or not the minutiae of the details are being appropriately considered in every way. This is such a pandemic crisis, and it has been around for so many I guess, hundreds of years. We cannot be the generation that perpetuates this. We have to look out for our next generation and the people we care about. I am so passionate about this, but not because of any particular self-interest necessarily, but just because we are human beings and we need to treat each other better. Thank you.
Dr. Aneesa Ibrahim.
Thank you so much for having me. My name is Dr. Aneesa Ibrahim, and I am a pediatrician at the Harborview Pediatrics Clinic, which I might say Dr. Danielson is a phenomenal clinic as well. I also, my patient population is essentially Black and brown children as well. I think in the content of this, one of the most heartbreaking things is what we as a community have to deal with. We just heard Dr. Danielson speak on the numbers. But those numbers also translate to real life experiences and real life issues that our people have to deal with. In the past couple of months, I have answered questions from my daughters that have been the most heartbreaking, including, is it safe for us to have an alarm system in our house? Because at 6'4", they know that their father is a Black man and be seen, his very presence can be threatening. Without doing anything, his very figure and his very presence can be threatening. And it's a heartbreaking thing to have to answer to my children. The other thing is, as Dr. Danielson pointed out, we know that children, Black children, are seen as a threat at a much younger age. And many families, both in my clinic and in the community, have said, at what point does my child go from being seen as a cute cub to a full-fledged lion that's worthy of being feared? Unfortunately, young girls, young Black girls, are seen as losing their innocence as young as age 5. And we have seen that young Black men can also be seen as the same. What I want to talk about specifically is the effects of structural racism, police brutality, and police violence, or even witnessing these things, the type of issues that this can create in the family, which is what we take care of as pediatricians. The framework for this is that policing essentially happens, police exposure happens with children in their communities where they should be feeling the most safe. And repetitive traumatic police experiences in children in their neighborhoods, which we know are over-policed in general, leads to traumatizing outcomes, which then leads to negative health outcomes. This is both mental health outcomes and physical health outcomes. These types of events are making our communities more sick. They are killing our communities. Black neighborhoods are over-policed, and who is seen as suspicious and threatening is at the discretion of individual officers. Now, we know that due to racial bias and racism, that policing happens to Black people at a much higher incidence. A lot of this, a few things I do want to see is, what are the types of exposures that lead to negative health outcomes? And right now, I do want to honor the work of Dr. Rhea Boyd. This has been her life work, and she wrote an incredible paper that really looked at where are the exposures that children interact with police or police violence or police brutality, and what are the outcomes that we see in these communities. Now, Dr. Danielson had already said that 1 in 3 Black men have a risk of being jailed in their life. That disproportionate destruction of family and family members, and that disproportionate witnessing of Black children and Black families, seeing what's happening to their communities. And also, they're also seeing the criminalization of both their family members, but also their peers at much higher rates, leads to negative health outcomes. Now, there's 3 different types. First is the frequent encounters, just physically seeing your neighborhood being policed. That essentially sends a message to children saying that we believe that there are criminals here, just point blank. And having the police presence in those neighborhoods leads to negative mental health outcomes. It leads to consistent stress that we have known. That kind of toxic stress leads to epigenetic changes, and that is a generational issue. That does not just affect the generation that is dealing with it. It affects many generations down the line. Second is exposure to violence, just merely witnessing a violent act happening to another person, not even to you, not even to a family member. Witnessing that violence leads to many negative health outcomes: PTSD, depression, poor school performance, police expulsion from school. They're essentially cascading down and affecting other social determinants of health and essentially doing a disservice to our children. And then the last is exposure to caregiver encounters. So knowing that your caregiver might have an encounter with police, and what happens with over-policing and the traumatic witnessing of repetitive negative encounters with the police. We know that Black men are incarcerated at a much higher age, at a much higher rate. They are injured at a much higher rate. They are killed at a much higher rate. And we are destroying families by doing this. We are leaving families without a caregiver, which leads to a socioeconomic impact. Parental incarceration in and of itself is associated with a very strong negative, very strong mental health issues, but also things such as asthma and migraines in children. So police brutality essentially disrupts families, and it disrupts generations of families that should be given the opportunity to be healthy. So as Dr. Williams said, we did send a letter to the committee essentially saying that in addition to declaring police brutality and racism as public health crises, we need to understand that racism is actually a root cause of many of the things that we are seeing here. It is not a time to mince words, like Dr. Danielson said. It is a time for us to get uncomfortable because many of our communities have been uncomfortable for years. We live in fear for years, and that persistent living in fear for children is unhealthy, and it is actually leading to negative health outcomes and death. Okay. In addition to essentially saying that we need these things declared as crises, we actually have specific demands in the letter, including exploring community-based alternatives to public safety and funding programs that we know address other social determinants of health, and using budgets that we are using for police right now instead to funnel into the communities to address many of these issues, including employment initiatives, education, and housing. So essentially, I think the ask here is very, very clear. It's allowing communities, specifically Black children and communities, to thrive by preventing the possibility of negative police interactions, police violence, and even more, the persistent fear of having an encounter that might lead to the death of a loved one or the death of, or a personal injury. Thank you.
Thank you so much. I will add some words before we finish up with Edwin Lindo. So I do want to add that when we talk about all of these issues and what the proposals that we have presented before in our demand letter that has been signed now by more than 4,000 healthcare workers throughout the state, is that our ultimate goal is to provide very concrete ways in which we can reallocate funding that is currently being used to over-police communities of color into programs and systems that have been proven by data time and time again to have more of an impact on our communities and help improve the health and well-being of all of our communities. I want to add on 3 different points to address this. The first being, we do support the abolition of police. I support the abolition of police. The reason being is that for some of you, you already live in an abolitionist state. There are no police that are coming in your communities on a routine basis, monitoring the streets. And it is based on the perception that crime does not happen there, which I will get to in my second point. But there are communities in the United States that already live in a police-free state. They're neighbors, they're your kids' friends' parents. And thus they are seen as someone who is not a threat. But the conversations that doesn't happen is what happens when those individuals go to work, and what kind of work are they doing when they go out into the communities where they actually exert their influence, which is often the communities of color, not in the communities that are more affluent and more white. The second being, well, they have to be in those communities of color because that's where all the crime happens. Thus, they're going to be there. We all know that police don't prevent crime. They are there to help try and control a population that they feel like are the criminals. What we know is that the population of the United States is 323 million people. The population of Blacks in the United States is 41 million, approximately 13%. The population of whites in the US is 235 million, approximately 73%. The number of murders in 2016 were 9,374. Murders by Blacks, 4,394 out of those, 52%. So people have now used that data oftentimes in the social media platform saying that, well, Black Americans create 50% of the crime in the United States, the murders in the United States. Well, if you take that murder by the population, 4,935 out of 41 million, that's 0.01%. Murder by whites, 4,192. If you take the murder of whites based on their population, that's 0.001%. Not much of a difference, not even statistically significant. So there is no Blacks commit more crimes or Blacks are more criminal, and thus they must be policed more. It is a perception, and it is a way in which we, within this community and within the United States, have been made since childhood to be seen as a threat and criminals that must be policed. And that doesn't need to happen within other communities, which is absolutely false. I want to take it to the next point, which is when we talk about enacting these policies, it is not to make our communities and the world more dangerous. The idea of reinvesting our funds into programs that have been deemed to already and proven to already work and help improve the health of the community around them. Think of it like this. When we created the curb cutouts for those with disabilities to be able to have better access to the sidewalks, it wasn't just those with disabilities who benefited from that. Women who are pregnant, pushing a stroller, people who are pushing shopping carts who need to get somewhere with their groceries. Everybody started using those cutouts. So it's not like when we ask for these funds to be reaccumulated and reallocated into communities, it's only the Black people that will benefit. We know that all of those in our community will benefit from this, not just one group. And so we want to make for sure that we are advocating for the health of our entire community. And that starts by centering those who are most marginalized. Edwin, Lindo.
Thank you, Dr. Williams. Again, to the council, thank you to the chair. We truly appreciate having just what we hope is the beginning conversation in an incredibly important topic. Similarly to Dr. Williams and to what everyone else has been saying, we take this incredibly close to the heart because it is directly affecting our communities, not in our work alone, but in the communities of the children we're raising, our grandparents and our uncles and our cousins. I'm a critical race theory scholar at the University of Washington School of Medicine, where I teach racism, race, and the understanding of power and white supremacy to our future doctors, to understand that racism has a direct impact on the health of the communities that have been historically and contemporarily marginalized and oppressed. So what does that mean? Why is the non-doctor speaking right now? Well, the truth is to provide some context. Being one of the co-organizers with Dr. Williams of the march that had over 10,000 people that showed up about 2 weeks ago, we had very simple demands. The first is, and what we ask, that this be the low-hanging fruit that this council can move forward on, that to declare racism and police violence as a public health emergency. That's what it is and how it must be declared. We know that King County Public Health has declared that, but they did not declare police violence as a public health crisis. We think as a county, as a board of elected officials, that statement should be made very clear. Another is to eliminate the legislative provisions that shield law enforcement officers from investigation and accountability. You all were just talking about this. It boggles my mind how we are determining policy for investigation based on statewide associations that have the self-interest of protecting those same individuals they're providing policies for, meaning the Washington State Sheriff's Association is creating the policy of self-reporting and self-investigation. That doesn't make any sense. Every one of the doctors that is here in this meeting, if they did something in their clinic that harmed the patient, they wouldn't get to investigate what that harm was and what it looked like. They also didn't get 48 hours to determine how they were going to share the story that took place when that patient had a poor outcome. And again, so those are different standards, yet for incredibly important jobs that are taking place in our community. Additionally, we talk about funding, as Dr. Williams said, funding programs that are directly actually providing support and help for communities to prevent crime from happening. Having done this research for quite some time, I am almost certain that if we provided housing, food, and education, crime in this country would go down 75%. The other 25% would be because folks have mental health issues that we should also be investing in. But here in Seattle and in almost every law enforcement entity around the country, law enforcement is the #1 mental health referral system in our country. And that's a sad reality that someone carrying a loaded weapon is the #1 referral system that we have in these United States. We should actually have experts that have been trained to engage with and to embrace communities who need help during these crises, but we're not doing that. We also want to demilitarize our law enforcement. And we, again, heard the conversation that those are moves being made, and I think we can move them, as Dr. Danielson said, much quicker, and we can do it faster, and we hope that we do. But the part I really want to hammer on and why this is excruciatingly important is that not only is Dr. Danielson likely to be 1 in 1,000 chance to die at the hands of law enforcement. The data tells us that young Black men being shot by police is a leading cause of death up to the age of 36. A leading cause of death for young Black men is to be shot by law enforcement. That makes me sit in this chair with the Afro-Latina daughter and think, if law enforcement did something to her and we were to sue the county for the misconduct of these law enforcement officers, and let's say we end up in a settlement, and actually King County has actually settled a number of law enforcement misconduct cases, that money is getting paid out of the general funds. My money is paying for law enforcement to terrorize my community. That can't happen anymore. I won't allow my money to do that. Actually, I want a refund because I won't pay someone to continue to terrorize me. The biggest point I also want to make is one on the grounds of human rights. Being legally trained, I've done a lot of research around the UN, the Geneva Convention, and the human rights that we all hold in this meeting. And one of those human rights is to be protected against racial persecution. Racial persecution is grounds for both refugee status and grounds for genocide. And it doesn't have to reach the caliber of what occurred in the Holocaust, which is where the definition of genocide came from. It just has to be a killing of a racial community in whole and or in part. The definition would allow, if we were to take asylum, if my good friend Hayden Hamilton went to Canada and knocked on the door and said, I don't feel safe in the United States, he would have grounds to receive asylum from the United States into Canada. That means right now in 2020, we are creating racial refugees. And yet our country is looking across the globe to find ways to support refugees, yet we're not supporting the communities and the refugees that we're creating in our own backyard. And I'm not suggesting that Black folks need to leave the United States or they should seek asylum. What I'm suggesting is that it is so awful that the UN would declare human rights violations right now. And so we ask that we not just take this as a point on the agenda, but that we actually take up the flag of justice, that we stick it 10 feet into the ground so that it is immovable, and that we don't stop this work until we achieve it. And the last that I would ask is that we make sure that we end the violence against protesters that are fighting under the First Amendment right for the justice of communities, even when that community isn't their own. We're talking about white folks, Asian folks, Black folks fighting for justice as protesters, and they're getting treated as though they are terrorists. And I can't stand for that anymore. And I will give my time, but it is an honor to join you all and to join this panel. Thank you.
Thank you so much, Edwin, and to all the doctors who joined us today. Your testimony was very powerful. Are you able to send us a written list of those demands that you just made so we can distribute it to our entire committee and council?
Absolutely.
Thank you so much, Edwin. I appreciate that. Madam Clerk, do we have anyone on for public testimony today?
Yes, we do, Mr. Chair.
Okay, so in our last 20 minutes, that's how we'll be using our time. Thank you so much. Thank you very much to our panelists and to presenters today. Now that we have finished our briefings, I would like to move into public comment. Having an entirely remote meeting is unusual for the King County Council, and I want to be sure that everyone who has called in understands the rules for public comment and how the process will be managed. First, some ground rules. Public comment must be related to items on today's meeting agenda and not be used for the purposes of assisting a campaign for election of any person to office or the promotion or opposition to any ballot proposition. It must also not include obscene speech. If a speaker fails to abide by these restrictions, I will rule the speaker out of order and require the speaker to exit the virtual meeting. Now I will describe the process. As all the members of the public joined the meeting today, they were automatically muted. I can see your name or last 3 digits of your phone number. Our committee clerk will call the names and numbers. When your name or last 3 digits of your phone number is called, staff will unmute your line. Please make sure to also unmute your line if you have muted yourself as a courtesy. Before you begin your testimony, please wait to be acknowledged to be sure we can hear you, and then start by saying and spelling your name so we can capture it accurately for the record. If you wish for your video to be turned on for public comment, please request this before beginning. You will have 2 minutes to speak, and we will hear a timer go off when you have reached 2 minutes. You can finish your thought, but also wrap up your comments to allow the next person to speak. If you go past 2 minutes, you may get muted. If you're listening on the TV or streaming, please turn that function off. Otherwise, we will hear feedback. If you are disruptive to the meeting, I will ask staff to hang up the call so you have to leave the meeting. Please hang up after you have provided your comment to make it easier for us to manage the call. You can follow the remainder of the meeting on King County TV, Channel 22, or stream online. The link to stream online is on the council's website, kingcounty.gov/council, and click on the Watch Us Live button. We will now begin the public comment period. A reminder to please wait to be acknowledged to be sure we can hear you. Madam Clerk, please go ahead and begin calling names, numbers for public comment.
Thank you, Mr. Chair. The first person is Elaine Simons. Please go ahead.
Hi, my name is Elaine Simons, ELAINE SIMONS, and I live in Renton, Washington. On May 31st, 2019, my foster son, Jesse Saray, was murdered by Officer Jeff Nelson in Auburn Police Department. He was number 3 of victims by this officer in less than 11 years. My question and my concern and statement is we need to unblock the lawsuit put out by Auburn, Kent, Federal Way, and Renton to allow the process of the inquest to go through. We have been fighting as a family since 2019, trying to have this case looked at, and it has been buried deeply. There are so many Black and brown and Native bodies being killed by police, not just in Washington, but statewide and nationally. And for families to sit here and be triggered over and over every time we see on the news of another police killing and no support to our families, it has been causing us a lot of, it's just re-traumatizing us over and over. And so I'm asking you, please unblock the inquest and allow us to be able to have answers for our families and bring peace to us. Jesse was in a mental health crisis, and under the I-940, no mental health backup was provided. Nobody came to de-escalate the situation. Only the officer came, and after he shot my son the first time in the stomach, and he was down, Officer Jeff Nelson did the execution shot into his head and killed him. And we believe that there was no reason for that double shot. He was already down and defenseless. I'm new at this activism. This is brand new, going out and sharing my story about my foster son. So I just, again, please listen to people, listen to the families, listen and allow us the opportunity for people to really look at our cases and see where some mistakes have happened. And if I can say anything, Officer Nelson needs to be removed and placed out, not have a gun in his hand while the investigation's going on. I'm afraid a 4th child is going to be killed. I don't know if I'm at 2 minutes, but yes. I belong to a group called Families the Front Line, and we're a national group of parents and family members who are trying to come up with police reforms. Thank you so much for your time, and I really hope that you take a look at Jesse Saray's case.
Thank you so much.
The next person is Ben Israel. Go ahead, please. You are muted on our end.
Yes, my name is spelled BENYISRAEL. Policing in the United States is inherently racist for the following reasons. The original police in the United States were slave catchers. After the Emancipation Proclamation, the 13th Amendment made it legal to enslave people that had committed a crime. Vagrancy laws were passed that made it a crime to be homeless or unemployed. The police were used to arrest former slaves, and the state leased them out to plantation owners in the convict lease system that lasted until 1928. Police also enforced racial segregation laws known as Jim Crow until 1965. In the 1960s, police and law enforcement agencies crushed the civil rights movement. The FBI created the Counterintelligence Program, or COINTELPRO. The stated purpose was to discredit, disrupt, and destroy all Black nationalist movements. In the 70s, Nixon declared a war on crime. In the 1980s, Reagan declared war on drugs. While statistics have shown that more whites use illegal drugs by percentage, a disproportionate amount of Black and brown people were arrested by police and put in prison. In the 90s, Joe Biden authored and Bill Clinton signed the crime bill that encouraged the growth of mass incarceration. Racist policing is a health crisis because it destroys society's most valuable resource, the family. It is difficult for families that are incarcerated to survive because one less person is contributing. And legal fees also provide a difficult challenge. It's difficult for the formerly incarcerated to get employment once they are released. Racist policing perpetuates poverty and social stigma, making it difficult to have access to quality housing, quality food, and quality health care. Poverty also impacts mental health and stress. Policing is a racist practice that helps keep so-called Black people sick, poor, and broke. It keeps modern-day plantations, aka prisons, full, so private companies and the state can make a profit off of free and near-free labor. Policing past and present shows the sickness and psychopathy of the American society.
Time.
Thank you so much.
Thank you. The next person is Abil, and I think it might be Abil will do. Go ahead, please. You are unmuted.
Hello, my name is Abiel Woldu, and I am the current chair of CACLIO, which is the Citizens Oversight Group for the OLEO office. I'm here today for two reasons. One, to say as the Community Oversight Group, we are here to voice our support for OLEO and its recommendations for the Sheriff's Office. And secondly, as a Black man from the south side of Seattle, I think this is an important conversation to have, and that it should be known that this is a public health crisis. I think a public health crisis is anything that causes an undue burden to a community of people and causes them to change their actions for that reason, whether it be COVID and causing us to stay inside, or for me, making sure that everything I do in the presence of the people that are supposed to protect and serve me give me undue stress, undue burden, and in all honesty, pain and suffering when I realize that the money that I pay in my taxes has to go and pay off people that have harmed my community, my classmates and my friends. I don't know if you guys know how that feels, but that gut-wrenching feeling to see that you have to write recommendations because you see your friend is no longer here, and you have to sit in a meeting and listen to somebody explain why and how that came to be, and you'll never be able to hear your friend's side of the story, is something that no person should live through. I do want to say that the recommendations offered today will help in that process. And outside of that, today, CACLIO has sent in a letter to the county council in response to body cameras, and I hope you guys take some time to read through those recommendations. I think not only will they protect the community, but they'll protect things outside.
Time.
Thank you guys for the time.
Thank you.
Thank you. The next person on the line is Alicia Bush. Go ahead, please. You're unmuted.
Thank you. Hi, my name is Alicia Bush, and I am an anti-racist activist in South King County. And we have been working really hard over the last several months to meet with our local communities. I live in Maple Valley, and with cities in South King to put together a proclamation to meaningfully address systemic racism, how it manifests in our communities, and how it harms our communities of color. We had a really powerful conversation last Thursday with Covington, Maple Valley, Black Diamond, and Enumclaw, and they were very engaged. It was a very encouraging bipartisan conversation. And this proclamation isn't just saying words. It's also with demands for accountability and ongoing work. And part of that accountability, I feel like, rests very heavily within our city government and law enforcement. I do not understand why the cities of Auburn, Renton, Federal Way, and Kent are in opposition to transparency. This protects everybody. And, when we look at situations like 12 days ago, another unarmed Black man was murdered for doing things that I have literally done myself. When I was in my 20s, I got drunk and fell asleep in my car and was woken by police and panicked and started to run. They grabbed my arm, called my parents, and I went home. Rayshard Brooks was murdered for doing the same thing that I did in my 20s. Why are there different outcomes? We have to address these situations, and we have to do it meaningfully, and there has to be accountability on all levels. Thank you.
Thank you. The next person on the line is Annalisa Thomas. Go ahead, please. You are unmuted.
Hello, my name is Annalisa Thomas, Annalesa. Thomas is Thomas. And I am co-founder of Next Steps Washington. I lost my son in 2013 in a police shooting. I would like to say that I fully support all the recommendations made by Deborah Jacobs and her office. They are plain and simple common sense. And that is the avenue we need to travel down, is common sense. Most particularly, I would like to speak to de-escalation. De-escalation needs to happen way before officers get to an incident. They have the opportunity to engage in target practice. They need to have the opportunity to engage in de-escalation tactics. And further, I feel like the lessons learned should be implemented. And the lessons I have learned in the last 7 years are an unarmed man, regardless of how long the time has been, should never be shot. There is another avenue, and police need to find and learn those avenues so that we lose less people to officer-involved shootings. And the last comment I'd like to make is about the witness statements for police. In our incident, I watched my son get shot. I was interviewed immediately and for 4 hours afterwards. If you are going to apply a 48-hour waiting period for the officer involved, you should do that to the witnesses that have been involved as well. So I think it should be an even playing field for all. Thank you for your time. I appreciate it.
Thank you. The next person is Asha Mohammed. Please unmute yourself and go ahead.
Thank you so much for this robust and vulnerable conversation. I'm sorry for everybody that lost their loved ones. Good energy, thoughts, and prayers are with you, from my family to yours. And thank you for sharing the terror that you guys go through.
Asha, we're losing you. Maybe try turning off your video and starting over if that works for you.
This is personal. Any color or a Black person, it's extremely. Is this better? Is this better?
Yeah, this is much better. May we restart Asha's time and let her go ahead again?
Thank you. My name is Asha Mohammed. I'm the Executive Director of Somali Youth and Family Club, which is a nonprofit. I'm a resident of White Center for 26 years. My condolences to every family that have shared that they lost their loved ones. And furthermore, for my 2 minutes, as someone that came into this country 26 years ago, we would like to have transparency in co-designing the responses and to be included in the conversation as humanly as possible. My position in understanding systemic oppression or systemic racism or racist structure is 3 steps, which one is reform, another one is to defund, and another one is to disband. We are having very volatile responses. However, for someone that has worked with victim of sexual assault, someone that has worked with children abductions, someone that has worked with vulnerable population where police was their first resort to call, there are many things that we need to look at it and honestly have a robust conversation of the failure of the public health system that we have. The lack of investment that at the Reagan time has happened in this country that is not addressed. The lack of investment in services, the lack of government doing its job and passing the buck to nonprofit. So I think I would like to have a better understanding, a better communication, a better transparency for what the process looks like. I am absolutely. Thank you.
Thank you so much, Asha.
Thank you. The next person to speak is Karen Chase. Please go ahead and unmute yourself. I've got Karen Chase. I think she left. The next person is Chris Franco. Please go ahead. You are muted. Chris Franco, would you like to speak? If so, please unmute yourself. I will move on. The next person is Hayden Hamilton. Please go ahead and unmute yourself if you'd like to speak. Hayden Hamilton. Okay, we've got Joseph Lockman. Please unmute yourself and go ahead.
Well, council members, thank you for the opportunity to give public comment. The points that I'd like to outline today are in support of the OLEO recommendations, and were also included in the February letter that a group of community-based organizations provided to council previously. And just to quickly outline the points, I'd like to emphasize that the King County Sheriff's Office should absolutely create more robust standards for use of force, such as the idea of only when there's an imminent risk of harm. Also discussing the implementing rules to prevent escalation. So rather than the framing of, we like the framing of de-escalation, but really talking about preventing escalation of incidents, including in reference to the killing of my trans Dunlop Gittens, thinking about the situation where detectives were, as according to the investigation, of the idea that they unnecessarily may have put themselves in harm's way. Again, aligning with Deborah Jacobs' comments and looking at the circumstances that led to a situation where they felt that there was an imminent risk, and essentially ensuring that we're not having officers escalating situations unnecessarily. Strengthening policies that are improving accuracy and utility of deputy interviews, and the idea of shifting to end of shift as opposed to the 48 hours, and again ensuring that there's not a double standard in terms of how civilians versus officers are being given a certain amount of time to prepare their statement for an interview, and also enabling the critical investigation review board to conduct a full thorough review, making sure that it's comprehensive, including the events that are leading up to a shooting, and discussing whether or not they really did use proper de-escalation tactics. And again, speaking though also in support of and the other families that have been affected by police violence, and noting that this was done, these are community-based, community-driven changes that organizations have worked on together to support, both with the inquest process, but also with supporting the recommendations that the Office of Law Enforcement Oversight has discussed today. Thank you.
Thank you. The next person on the line is Julia Dorman. Please unmute yourself and go ahead and speak. Julia Dorman, would you like to speak? Okay, the next person is Christiana. You are unmuted. Go ahead.
Hey, thank you so much. And thank you also for holding this important discussion. I know it's been long overdue for a number of years. My name is Christiana De Leon, Kristiana. De Leon is lowercase d-e space capital L and then E-O-N. I will also mention that I am a council member for the city of Black Diamond. While I'm not here to say that I'm here representing the council or actually any of the participants that were in the four-city meeting that was alluded to earlier by organizer Alicia Bush, I can say that it was an incredibly powerful conversation and a very critical first step for how to engage more suburban and more rural communities in this conversation. And I'm going to ask that as we move forward with it, because it does appear there was a lot of strong interest and a lot of, especially from a lot of different perspectives and people coming with a lot of different backgrounds, I'd say, that we really look at how we include these more rural and more suburban communities in this conversation, particularly because, for example, my city is not so diverse yet, but we are growing and changing. And it's going to be very critical that we work and move proactively as we move forward into the next chapter of our city, that all of these conversations really also integrate the needs of these smaller communities. So I'm just asking that we become part of that conversation and maintain also that these more southern or more eastern parts of the county are represented and brought into this conversation as well. Thank you though so much for everybody who has been participating. It's really powerful. I'm looking forward to doing at least whatever I can in my capacity to move that work forward.
Thank you. The next person is legal team. Please give us your name, and if you could spell it, that'd be great.
Sure. My name is Corey, Corey, last name Gilmet, Guilmette. And I'm an attorney at the Public Defender Association who works on police accountability. And I'm testifying today to share recommendations made in a February letter from 15 community groups to the King County Sheriff's Office regarding its use of force policies. KCSO's use of force policies must be improved in 4 critical areas. First, KCSO must create a more robust standard for the use of deadly force. As Olio has recommended, the use of deadly force should only be authorized when there is an imminent risk of serious physical harm to the law enforcement member or others. Second, KCSO must implement policies that seek to prevent escalation. Just as de-escalation is a critical technique in avoiding the unnecessary use of force, preventing escalation must be as well. Third, as Olio recommends, deputies involved in a critical force incident must provide an oral interview prior to the end of the member's shift. There is no reason for treating police officers any differently than any other person in a homicide investigation. Fourth, as Olio has recommended, the Critical Incident Review Board must provide a comprehensive review of all officer-involved shootings and serious force incidents. And I want to end by saying that this is a technical topic, and it's easy to view topics like this dispassionately as a result. However, these recommendations come at the very same time that KCSO is suing to block King County's inquest process, and we've heard about the consequences of that from other families today. But what we're talking about here is life and death. We're talking about fathers, mothers, sons, cousins killed by police officers. And I ask that these changes be made with the urgency that reflects the value of the lives that have been lost and unfortunately will continue to be lost. Thank you.
Thank you. The next person is Marla Murdoch. Please unmute yourself and go ahead.
Can you hear me?
Yes, we can.
Okay. My name's Marla Murdoch, M-A-R-L-A, Murdoch, M-U-R-D-O-C-K. Thank you. I'm a concerned constituent of District 1. I'm a white affluent person, and my heart is broken from the stories that I hear and continue to hear from families who have lost members, sons, daughters, fathers from police violence. This has to change. If we look at investigations that are done, many of these families have received monetary settlements. There's a big disconnect and something's wrong that if you can omit and pay and give money, which in a sense is saying that that was a wrongful death, these police officers and sheriffs stay on their jobs. If they are by some chance fired, they go to another department, have nothing follow them, and continue the same pattern. I'm also here primarily in support of Olio's report and the 43 recommendations they outlined, and also in support for the demands and fact that police violence and racism is truly a public health crisis. This cannot be understated. This is crucial to be addressed now and not just be put on the table as it has year after year. Policy changes are just a first step. Also, training of law enforcement that emphasizes shoot to kill instead of de-escalation must be changed. And most importantly, we need to address the systemic racism that exists in the law enforcement system, which results in disproportionate killing and devaluing of Black and Brown bodies. And Olio's Olio's recommendations and also the demands that we have heard from doctors and the professor at the University of Washington, they must be addressed.
Thank you. The next person is Melissa Taylor. Go ahead, please. You are muted.
Hello, Melissa Taylor, M-E-L-I-S-S-A. space Taylor. I would like to thank the chair and all of the guest speakers today for your advocacy to make our community better. I appreciate the opportunity to listen to the conversation. I'm here today as a member of King County Democratic Central Committee's Executive Board. For context, this body consists of 60 members, including representatives from each of the 17 legislative districts in King County, as well as 9 officers, all elected by the over 1,000 elected precinct committee officers in King County. Last night, we voted unanimously in support of a resolution that included a series of provisions directed at the King County Council, Executive, and Sheriff's Office, which will be sent separately. But in the context of today's Olio report, I would like to share the following 2 resolved clauses. Be it further resolved that the King County Democrats call on the King County Council and King County Sheriff's Office in cooperation with Olio to improve internal investigative and review mechanisms regarding officer-involved shootings, including responding to each of the recommendations in the February 2020 Olio report. Be it further resolved that the King County Democrats call on the King County Sheriff's Office to cease fighting against the reformed inquest process of King County, to require officers show up to testify when summoned as a part of inquest when an officer-involved killing occurs, to stop all efforts to prevent inquest juries from making a finding of criminality as part of the inquest process. From a personal perspective, as a white woman, I want primarily to affirm, support, and stand in solidarity with the views and policies shared by today's guests. That being said, in response to Councilmember Lambert's comments earlier, I want to state very clearly that the current state of law enforcement in our county also makes me feel less safe. And deflecting in this moment to talk about how people you talk to love their police officers concerns me about the level of seriousness and urgency you bring to ensuring the safety of everyone in our county. For all of the county council members, every use of force by our law enforcement should be viewed as an error that needs to be corrected. We should not be using force against our civilians. Thank you.
Thank you. The next person is listed as Nick's iPhone. Go ahead and unmute yourself. And if you could give us your full name, that'd be great. Nick.
At the end, I'd like to make a comment.
Councilmember Lambert, did you say something? I couldn't hear.
At the end of public testimony, I'd like to make a comment.
Okay.
Nick's iPhone, one more chance. Okay. The next person is Rachel Scott. Go ahead, please. Rachel Scott, if you want to unmute yourself, you can speak. We'll move on. The next person is Sean Goody. If you'd like to speak, please unmute yourself. Go ahead.
Thank you. It's Sean Good, SeanGoode. As we speak to pandemics, the current COVID infection rate for Washington State positive tests is 6%. And as a result, yesterday, Governor Inslee declared on Friday that he's going to mandate the wearing of masks in indoor public and outdoor spaces, which seems like a just response to a pandemic that seemingly is not going away. Well, the population of African Americans in King County is also approximately 6%. And we also have an equally as dangerous pandemic present in the disease of racism. The city of Seattle has used about $233 million to respond to COVID. That type of investment is the same investment that's necessary to combat the vicious disease of racism in our community. I urge the county council to act with expediency in divesting from areas that perpetuate the spread of the disease of racism, particularly as it speaks to the work in law enforcement, that if law enforcement is leading to the deaths of Black people or the incarceration and ultimately the destruction of community for Black community, then we should consider immediately ways that we can divest from law enforcement and begin to invest in community-based alternatives. To say that the experience of some is different than the experience of others, and as a result, this type of expedient response is unnecessary, is just like the people who are advocating for not wearing a mask right now because they've been in plenty of conversation with people without masks on and have yet to contract COVID. It is imperative in this moment that we respond with urgency, that we divest from these institutions that perpetuate systemic racism and begin to invest in the cure, and do it with the same zeal and energy that we have for COVID-19. Thank you so much for creating the space for me to share. Remember, 6% Washington State, that's the positive test rate. 6% of residents of King County are African American. The numbers are the same. The impact on death is probable. Let's respond accordingly.
Thank you. The next person on the line has the last three digits of their phone number as 344. Go ahead, please. The area code is 206. The last three digits is 344. You are unmuted. If you'd like to speak, please go ahead.
Madam Clerk, moving forward, may we only ask people once?
Okay. Yes, Mr. Chair. I believe I've called everyone on the line.
Thank you so much for those powerful testimonies. Councilmember Lambert, did you want to say something?
Thank you, Mr. Chair. I certainly do. Apparently what I said was completely misunderstood. I did not say moving forward was unnecessary. As a matter of fact, I'm the sponsor of the FIRST program and many other programs I also have children of color, so I have personal experiences. But my point was that we all need to work together, and it's going to take everybody working together. And I think blanketly saying that any group is all wrong is not going to help us get to the bridges that we need to do to make the changes that we are all agreeing need to be made. So I think that we need to focus on making sure that we're all working together. Thank you, Mr. Chair.
Thank you, Councilmember Lambert. I just want to thank everybody who joined today's call. Thank you especially to the families who've lost loved ones, who continue to join us and re-traumatize yourself, speaking about things that no family should ever have to face. And you do so with the hopes that you're creating a better world. And I assure you that we are continuing to work on the things that you have spoken about. Your efforts are not in vain. And when we talk about creating a better world, the energy and the momentum that we're feeling right now is not people saying they want to tweak and create incremental change. People are saying our system is fundamentally broken and we need a new system of public safety that's rooted in community-based alternatives and economic justice. Those are the things people are saying. You know, when doctors and medical professionals come on and they tell us that police are the number one responders to mental health crises, that is a fundamentally broken system. We need to make sure that we're able to reduce the duties of our police departments and reallocate those resources to more effective places. That's what people mean when they say defund. When they say defund, they're not saying promote lawlessness and eliminate accountability. They're saying let's invest in the things that we know work better. So hopefully we can work on those big, bold changes where we're saying that mental health officers respond to mental health crises. Youth violence is met with people who have relationships and trust with the youth through youth development programs. That traffic management is not done by somebody with a loaded weapon. And that system shows us why we've lost so many people at traffic stops. Countless names, Black individuals being killed at traffic stops for a system that has no business having an armed weapon or a loaded weapon in that situation. We can have a bike brigade, an unarmed bike brigade. These are all alternatives that we should be pursuing. And I know those kinds of changes require legal changes that our council is currently working on. Our charter has restrictions. Our process of negotiating and bargaining with unions has restrictions. And those are all things that we are focused on. So I assure you that the conversations about big, bold changes that people have been telling us, those are things that we are pushing for and that we will continue to fight for. So thank you so much, everyone, for joining us today. And we will continue working with you. And for those of you who have asked for more transparency and collaboration, please reach out to our office directly so we can make sure that these public meetings are reaching impacted communities and communities that may be not seeing this kind of public collaboration happening. Councilmember Dembowski, did you want to say something? Please go ahead.
Thank you. I hate to follow the chair's concluding remarks, but I did want to thank you personally for putting together today's meeting and for assembling the panel that you did. To be candid, I had to turn off the video because of the emotional impact it had. It was great to see Dr. Danielson, but also many faces in the medical community that were new to me, and to hear and listen to their voices was particularly compelling. And I want to join you in your pledge to implement the changes that are being sought in a big way and to be bold. And I want to thank the panelists for carrying the burden that they shouldn't have to carry, but did, and continue to do so every day, but also here publicly. And at a minimum, express my allegiance, alliance, and support for getting the work done that we have to do. And I look forward to doing that with you. And thank you and the public who commented today, but especially that panel. I hope KCTV will package that and replay it many times. It is very compelling material that I think we should all hear. Thank you, Mr. Chair.
Thank you so much, Councilmember Dombowski. We will definitely follow up with our KCTV and make sure that that is something that we share publicly. All right, that is the end of this Law and Justice Committee. Thank you so much again, everyone, and we will send out information about the next one. Have a good day.